All right, so there are going to be people that don't have a Smith machine available to them. We're going to show you what to do for that. But I love the Smith machine for this exercise because I feel like the range of motion and the way it just feels better than a dumbbell or than just a barbell by itself. Again, not everybody's going to have a Smith machine, so we'll show you what to do. So where am I setting this up?
So this is going to be a really similar setup to any other hip thrust in terms of having the shoulder blades sort of grabbing the side or edge of the bench. So Dr. Spencer's in a really good spot there. And having a vertical or nearly vertical shin. Again, to make sure that we're not biasing the quads or hamstrings too much by having the feet too close or too far away, really emphasizing the glutes. Now, this is a good bench height for most people, and you can see that, like in a perfect world, at the top, from shoulders to knees, you're parallel to the ground. And the Smith machine works especially well for a hip thrust because it's locked in place in terms of the range of motion, and you can start from the top. For a lot of people, starting from the bottom, especially with a barbell, can be really awkward, rolling the bar onto your hips, getting your legs into position. So this is just a super convenient way.
I think that's why I like it the best.
Yeah.
Because I start at the top. Otherwise, sometimes I have to start at the bottom. I'm like, oh my God, this is a lot of weight to get on there.
Right. And you can shimmy yourself into place before you have to unrack the weight.
Okay, where do you put your bench though? You have to you have to maybe change where the bench is because the bar won't move. It's fixed in one position. So you're actually going to be adjusting this to make sure that, where do you want the bar then to be placed on your...
So we want the bar to be right on the hip crease, right where your body folds. And it shouldn't be all the way up to like your belly button or providing a lot of discomfort. Some people will even move it slightly onto their thighs, but that can sometimes be awkward with the Smith machine because of the way that the bar path is fixed. But there's some wiggle room there to have it right on the hip crease, and then that's what's going to determine how far away or how close the bench is just based on your own body size.
Okay. The other thing is, you probably want some pad. It's very uncomfortable with just the bar. So either get one of these pads or you get those big blue cushion things. What do you call those? What are those?
AirX pad.
AirX pad.
No, you don't have to be a hero and really deal with that kind of discomfort, because if the bar really hurts on your hips, it's going to make it hard for you to really lock out at the top. So you can use a squat sponge or some sort of padding every time.
Yeah, okay. So I'm starting off, I get it here, get it to the bottom position or to a lower position where I can get under the bar, and then I push up a little bit, my hips to unlock it, and then roll it forward. Then what? You told me before, tuck the chin?
Yep, we want to tuck the chin and have our eyes forward. Sometimes I like to use the cue, pretend you're watching TV, right, through the entire rep. That avoids really looking up towards the ceiling and throwing the head back, which is not wrong, but makes it much easier or more likely that we're going to really arch through the low back. What we want instead is to pull our ribs and hips together into what's called a pelvic tilt, squeezing the glutes hard at the very top with a nice pause.
All right, so then how far do I go down?
So that's going to depend on the person. Many people will not be able to touch all the way down here, and that's okay, because the top, the squeeze, the lockout is really where we're focusing for a hip thrust. So you see here, Dr. Spencer can go all the way down because he's pretty tall, but we just want to go as far down as we can, maintaining the ribs and hips distance. Once that starts to increase and we really have to arch through the low back in order to continue to descend, we don't get extra credit for that range of motion. It isn't necessary.
I don't even feel it when I get down there.
Yep. And that's normal. So it's really all about that top lockout and that top squeeze.
Again, then where legs or feet, hip length, shoulder length, where do I put them?
Most people are going to prefer to be about shoulder width apart, toed out slightly, maybe like 80 to 90% of folks. But from there you can play around. Maybe you like a more narrow stance. Maybe you like your toes straight ahead. It's whatever is going to help you feel the most squeeze in your glutes. Again,
this is one of those exercises you really have to mess around with it to know where you feel it. Don't be afraid of just trying different things, honestly, because I've worked with my wife. She has to put her feet in different angles in every position, and I have to do it different from her, and it's probably different from Coach Bryce here as well.
Oh yeah, there's lots of individual variation within exercise technique. We want to fit exercises to your body, not the other way around.
This is a great exercise too. Some people won't be able to get that range of motion with the different squats, patterns, and this is a way to really hit those glutes effectively. I like this.
Oh, absolutely. It's a great way to build strength. It will transfer to your squat and deadlift performance, and within a few months of training the hip thrust, just about anyone can use more weight here than they can squatting or deadlifting. So it's a great chance to really push your upper body or your lower body strength safely.
Yeah, it can actually feels like it's not so hard on the lower back. Obviously, if you do the range of motion incorrectly, it could. But I like this exercise.
Yeah, great option.
Cool.